So actually we thought earlier it is only for the high socioeconomic status people get the heart attack. It is not true now, because it is actually the low socioeconomic status and the middle level economic status also get the same event as, actually we calculated these things in every year in National Interventional Council program. So when we take the data, what we see is there is no difference in the economic status to make the heart disease different. Earlier we thought that the high economic status people will not do exercise, but you can see that even the film actors, politicians, bureaucrats, doctors, they do more exercise in the gym rather than the poor people only eat the food and less activity. So if you look at the exercise capacity and the food habits, they totally change. You can see the lean people who are coming from the high economic status people with the pot belly is coming from the low economic status. So that makes a difference. Second is actually the gender. You asked me. Female people are definitely having high incidence of heart attack nowadays. Earlier they were rejected by the family or even themselves. Now it is not the story. Even they themselves come forward and the family also looking after them and getting the heart disease, and they are also treated. If you look at the population here, 35% of the people inside this center is female patients. Age group is actually, I told you sir, below 20 years we seldom see heart attack, but beyond 20 years we see a lot of patients. And one interesting part is actually, earlier we don't see heart attack beyond 80 years, people don't survive. Now we see people at 90 years. I have done angioplasty for 97-year-old people, and actually we took a calculation of octogenarians, that means beyond 80 years. We have done a data of, even in my center in Kollam, we have done more than 80 years, 120 angioplasty just in 1 year time. That means our incidence is going up like anything, number one. Number two, they are cared by their own children. Number three, they have pension schemes. Number four, even they secure money for their health now, like Americans and Europeans. We are also growing up. So we are now, according to the Prime Minister, we are number one, number five. Number three, when you become number three, octogenarians number will become double or triple, and that is age no bar for the treatment. So actually, luckily, I was the first Keralite to become the National Interventional Council chairman for 2 years, 2022 and 23. I have done the best cardiology conference ever in the history of Cardiac Society of India National Interventional Council in Hyderabad and Ahmedabad. Number three, I am the course director of the CTO program in India. Course director, CTO means chronic total occlusion, patients with 100% block. Those 100% block is the reason of people going to the bypass surgery. I seldom refer a patient for bypass surgery because I can do most of the cases. I am telling with confidence, and that is why people are calling me. Today morning the call came from the Premium Institute of Mumbai. Sir, can you come there for 2 days training? So that means people wanted to see the complex angioplasty done by me so that they can also learn out of it. So luckily I am the course director of IJCTO. Number three, actually, you maybe heard about Amrita Institute. That is actually, they have given a Master Operator Award in 2012 when one cardiologist died. Actually, they selected only one cardiologist so far as a Master Operator Award. That is, luckily came to me. Number four is actually, I did the Best Case Award in CTO. Not only in India, like also in the gym. There is a meeting happened in Italy. I got a training from interventional cardiology training I got from Italy. So these are all some of the things, and first cardiologist to start a cardiac center in any ESI hospital in India. That was in 2013, still running for the last 10 years. The first cardiac center in public-private partnership model in any civil hospitals in India. That is actually in Haryana, which has happened. Ambala, Panchkula, Faridabad and Gurugram, which has never happened. We actually started a public-private partnership not only in Bihar, not only in Haryana, also in Uttarakhand now. In Uttarakhand, in Dehradun, we started a cardiac center. This is actually again our achievement. And I do angioplasty for patients with kidney diseases. So actually kidney diseases, nobody does angioplasty. Why? The contrast which is used for the kidney patients or the angiogram and angioplasty will damage the kidney. I do angioplasty without using contrast. and that is not done by the largest data in the world is with me, which is called zero contrast angioplasty. I give lectures in almost all conference. I am also fed up in giving lectures because everybody will call me for that, and they will ignore my other skills and they will tell, okay, zero contrast means you have to give to Prathap. So zero contrast angioplasty maximum number in the world is done by me, and the maximum publication also done by me. So these are some of the specialities which I do, and the maximum left main angioplasty, that means main vessel block, which is actually having the largest data of 700 patients published in Indian Heart Journal, again by me. These are all not only by me. Luckily, I got a chance to do that. I was trained in Italy by a world-renowned interventional cardiologist, Dr. Cantt. We should actually acknowledge that this center, Ambala Civil Hospital, I brought him also to do cases just 1 year back. I have a huge plan of starting some training program in this institute every 3 months. I'm assuring you, we will have a training program in this place, which bringing nearly 25 to 30 cardiologists from all over India to show that a civil hospital can train people, and by which that will spread all over the country. And I have done once, now I'll continue to do that with the help of some of the international people.